Hello everybody, I am Strangler. Today I am going to explain to you cholinergic agonist. I will try to explain in English firstly, then my friend will try to explain in Kazakh language. We topic is cholinergic agonist. What is the cholinergic agonist? Cholinergic drugs, also called the cholinetic drugs, are agents that mimic the action of the diagnosis neurotransmitter acetylcholine. They are direct cholinergic drugs as they bind to the stimulated cholinergic receptors. Cholinergic agonists are two types. Direct action cholinergic agonists bind the directly to cholinergic receptors, and direct action cholinergic agonists increase the acetylcholine ability to at cholinergic receptors. Can you open the case? Briefly, I read for you the case. A 27-year-old man come to the emergency department with complaints for vision, pain in the eye muscle, and they can talk for a long time with the eyes full open, as well as the difficulty shaving and swallowing. According to the patient, a pain increase in the evening. The doctor suspected the patient of the myasthenia gravis. Diagnosis it with atrophy, and the result was positive. Can you open the other slide? No, I explained other slide, please. No. About mechanism slide. Okay. Firstly, muscarinic M1, M2, M3, M5, and M2, M4 are each of them different chemical structure and anatomical location. Participates in the regulation of the mental, behavioral, sensory, motor, and autonomic function in the central nervous system. The function of the muscarinic acetylcholine are carried out by the interaction with the G proteins. Type 1, type 3, and type 5 are either the activation of the PKC and the calcium sensitivity enzyme by GQ11, leading to activation of the PLC IPC3, DIG calcium 3 pathway. DIG indicates that the stomach muscle involved in the opening calcium canals. IP3 releases calcium from the endoplasmic reticulum and the cytoplasmic reticulum, and from biological response. Other slide, please. PLCs are cytolytic enzymes that are transferred to plasma membrane during the stimulation of the receptors. When activated, the hydrolysis to intracellular signals for lipids, DIG production, IPC, and small membrane phospholipids, phosphodiasteroyl for 5-biphosphate. DIG, PKG directly affect some membranes of the family. IP3 diffuse into the endoplasmic reticulum, where it activates IP3 receptors on the membrane, leading to the release accumulated calcium endoplasmic reticulum. The release of the calcium from these intracellular stores increase the calcium levels in the cytoplasm within seconds and activates some calcium-dependent enzymes such as the PKCS and the calcium calminoidum sensitivity enzymes such as the PDA hydrolyzing CAMP and calcium calminoiding PK sensitivity family. Depending on the differentiated function of the calcium calminoidin kinase, and PKC can regulate many of the downstream events in the activated cells. The drugs. Yeah. No, before drugs. Before, not other. Yes, before. Yeah. Now let's come to the drugs. Prosernium. I will cover the. I'll expect firstly this drug is a cholinesterase inhibitor. What is the cholinesterase inhibitors? Cholinesterase inhibitors, depending on the character of the action on the enzyme, are divided into the substance with reversible and irreversible action. Reversible ones cause the reversible inactivation of the enzyme because they form labial bonds with it. Irreversible drug from a tight covalent bond with cholinesterase, so inhibition of the enzymes. has an irreversible character. The body is slowly hydrolyzing with the water. We can say that approximately 20 days. And acetylcholinesterase inhibitors provide an anticholinergic effect by blocking life to acetylcholine product and angiogenesis in cholinergic nerve ending. And this causes acetylcholine to accumulate in the synaptic case. These drugs can trigger this response to the alkaline receptors in the body, including both muscarinic and nicotinic receptors of the autonomic nervous system, as well as the neuromuscular junction and the brain. However, the effect of the choline receptor inhibitors on the central nervous system is dependent on their ability to cross hematocephalic barrier. Substance containing tertiary amino group, we can say posatimigine and galantamine, easily penetrate the brain and act on the central nervous system. The typical effect anticholinesteride drugs are similar to those and cholinesterase with a direct action. Other slide. Yes. Procerium is a synthetic compound. The procerium is polar and therefore does not enter the central nervous system. Is affected skeletal muscle in the greater than that of the passage made and can stimulate contraction. The duration of action procerium 2 to 4 hours. It is used to stimulate the bladder and the bowel and is also used as an antidote to tuberculin and other competitive neuromuscular blocking agents, drugs associated with sympathetic treatment of myasthenia gravis. You remember that in the case of the right myasthenia gravis, for this we used procerium drugs. And then continue. Myasthenia gravis is an automated disease in which antibodies recognize nicotinic receptors on the skeletal muscle. This reduced the number of the functional receptors and as a result decreased the muscle sensitivity to acetylcholine. Muscle weakness and rapid muscle wasting are features of disease. Anticholinesterase agents play a key role in the diagnosis and treatment of the myasthenia gravis, and they increase the muscle situation. Procerium is also used in glaucoma. Other side effect. Other side effect. Side effect of these drugs included salivation, flushing, lowering of the blood pressure, nausea, abdominal pain, diarrhea, bronchospasm, bradycardia. They are contraindicated in bronchial asthma, heart disease with the condition disorders, parangacy. Accidentally posing by the cholinesterase inhibitors can occur in my setting because these agents are not only used clinical but are also used agricultural and household insecticides, and accidental poisoning sometimes occur during their manufacture on use. Many of the drugs are extremely toxic and were developed under the military or as nerve agents. The acute toxicity of all these agents result from the accumulation of the acetylcholine at cholinergic synapses. With increased inhibition of the acetylcholinesterase and accumulation of the acetylcholine, the first manifests are muscarinic stimulation, followed by nicotinic receptors, followed by desensitization nicotinic receptor. Excessive inhibition can lead to cholinergic stenosis, which ultimately increases the consciential disease. We can say nausea, vomiting, diarrhea, excessive salivation, and then respiratory distress, bronchospasm, and increased bronchospasm secretion, cardiovascular distress, bronchocardia or tachycardia, AV block, hypertension, visual impairment, meiosis, blurred vision, sweating, and lost skeletal motor function. We can say the progressive throat coordination, muscle cramps, weakness, and vasculation, and paralysis. Central nervous system symptoms. Central nervous system include agitation, dizziness, and the mental confusion. It is usually caused by the paralysis is skeletal muscle necessary for the breathing, but it can also result from cardiac arrest. The first step is treatment of the anticholinesterase poisoning should be infection as increasing dosage of the atropia sulfate to contract any adverse effect resulting from the stimulation of the muscarinic receptors. Mechanical respiratory support may be recording as atropia will not allow the skeletal and respiratory muscle paralysis. Okay, I finished it. You can start. Thank you for the listening.